Lieutenant Governor of New York State. In 2004, she founded and is now chairman of the Committee to Reduce Infectious Deaths, also known as RID. It's a nationwide educational campaign, and I believe we passed out, I hope we did, if we didn't, we will. Yes, we did, more information. It's a nationwide educational campaign to stop hospital-acquired infections. RID has made hospital infections a major public issue. It has provided compelling evidence that preventing infection improves profitability as well as saving lives. RID has won legislation in 34 states, and including Washington, D.C., for public reporting of infection rates. RID has become synonymous with patient safety and clean healthcare institutional care. Betsy McCaughey's research on how to prevent infectious deaths has been featured on Good Morning America, the CBS Morning Show, ABC's 2020, and many other national programs.
Even the Hard Rock Cafe.
Betsy McCaughey is the author of more than 100 scholarly and popular articles on healthcare policy, infection, medical innovation, and the economics of aging. Prior to entering healthcare policy field, Ms. McCaughey earned a PhD in constitutional history from Columbia University. She is the author of 2 books on that subject. She has taught at Vassar College and Columbia University, and she produced prize-winning studies while at 2 think tanks, the Manhattan Institute and the Hudson Institute. From 1995 to 98, she served as the Lieutenant Governor of New York State. She focused on healthcare issues at her time there, and her bills became models for legislation in many states and Congress. She's extremely dynamic, and I know you're all going to enjoy our affiliation with her and her organization. So please, let's give a nice round of applause for her.
Thank you. I love working with this woman. Whoa. I am so glad, very glad to be here, and proud to be announcing this collaboration with the Strauss family and with CareOne. We are launching and celebrating a collaboration to improve care and prevent infections and other healthcare harms. RID's goal has always been, from its founding in 2004, to reduce the risk to patients of suffering a terrible healthcare infection. But by partnering with CareOne, we know that we will be reaching some 20,000 patients a year who receive compassionate and excellent care in your facilities. So this is a tremendous opportunity for the Committee to Reduce Infection Deaths. 20,000 patients a year. What an opportunity for us. And frankly, what a fortunate day it was when Tim called and we were able to meet with Lizzie and also with many of your caregiver teams. It's really been a terrific trip already, and we're just getting started. I have to say, from the moment I met with Lizzie and Tim and with Toya, they just exuded commitment, compassion, dedication to the highest quality care, and that's what RID is all about. We only have one goal. We're a not-for-profit. We have only one goal: to save lives and spare patients from the agony of infection and healthcare harm. So, working together with Toya Cornelius, as you know, CareOne's Chief Clinical Officer and a very, very talented woman, we've designed a curriculum. We're going to be rolling it out at CareOne facilities around New Jersey. The emphasis is always on highlighting the best research, the proven protocols and precautions to protect patients from infection and other healthcare harms. And by adopting these protocols and by monitoring for compliance in all the facilities, CareOne will be earning RID certification, RID recognition, as a true sign of excellence in patient safety. It's something that they can offer families whose loved ones are being discharged from an acute care hospital. Here's where to go. You know your loved one will be safe there. That is the idea behind this collaboration. For me, it's a tremendous milestone because, well, let me just give you a little bit of the history of RID. Way back in the 1990s, when I was Lieutenant Governor, it feels like slightly before the Civil War, New Yorkers, I was a New Yorker at the time, New Yorkers came to me with all kinds of health problems. But increasingly, it was the same terrible story. They had gone to the hospital even for the happiest reason, to have a baby, and contracted a deadly infection. So when I left office in 1998, I swore I had to do something about this. I had literally attended the funerals of some of these victims of hospital infections, like John Crescenzo, I remember it so vividly, Middletown, New York, cancer patient, who died not from cancer, but from infection. So often that's the case. So I founded RID, and at first our focus was on acute care hospitals. As I did the research, what was apparent to me is that we have the knowledge to prevent these infections. What is lacking is the will to achieve real hand hygiene compliance, the will to ensure that every patient has an environment that is truly clean and disinfected, the will to employ the latest technologies that can reduce infection risk almost to zero. So, as I said, we began by focusing on acute care hospitals. And in those first 14 years, we achieved a great deal. When we founded RID, not one state required hospitals to disclose their infection rates. Now, Tim said 34. I'm proud to announce, as of today, 38 states. We went from state to state talking with lawmakers about how important it is that families be able to identify which institution offers the safest care. And needless to say, it's a huge incentive for hospitals to reduce their infection rates. By the way, we were also very much behind the decision by Medicare to stop paying acute care hospitals to treat infections they caused, right? It goes right to their bottom line. That was under the Bush administration. Actually, that was a funny story. I'll stop and tell you. A long time ago, I taught at Columbia, constitutional history. And I was just a kid myself. So when I went on to the healthcare field, I kind of left that behind. But one day I'm in Washington at a luncheon meeting, and there's a very impressive young man seated to my left. And we're talking about healthcare issues. And finally he looks up at me and he says, "Professor McCaughey, don't you remember me?" He said, "I was in your con law class." So that was so many years before, right? But this young kid had grown up to be a very important guy. He was deputy policy director to the president. Can you imagine? He didn't even always do his homework when he was in my class. But so he had this important job, and I said, "Jay, let's put into place an initiative that incentivizes hospitals to reduce infection. Let's bring it right to their bottom line." And we devised that program. So it's been a wonderful thing. So anyway, back to RID. For the first 14 years, we focused on acute care. And then we realized 1 out of 3 baby boomers will spend some time in a post-acute facility. 1 out of 3. We need to make sure that we are there for every single one of them. So we have turned our focus a bit, broadened it, to reach out to acute care facilities and now post-acute care as well. That means 3 million patients a year. 3 million patients nationwide if we reach all of them. That's quite an incentive. And let me just say, it was so exciting the first day I toured the CareOne facilities because I sensed, I could see, a commitment to achieving real excellence in infection prevention. And the reason I say that is this. Too often, the CDC, the Joint Commission, APIC, Society for Healthcare Epidemiologists of America, all the groups, they say, well, we really can't expect long-term care facilities to achieve the same level of infection prevention, to put into place the same precautions as acute care hospitals. And you know what I say to that? Nonsense. Of course we can. The fact is, patients who are living longer in these facilities deserve more infection prevention, not less. And that's why I'm so excited to be partnering with CareOne, because they share that commitment. We're going to get that done. And I'm just going to be launching a few of the ideas today. But it's very exciting to see that Lizzie and Tim and Toya and many of the people here with whom I've already met share that belief that patients in long-term care facilities and post-acute facilities deserve every bit as much attention to infection prevention as patients being treated in acute care hospitals. And by the way, let me add this. All of the recent research, for example, by Dr. John Jernigan from Yale, show that there is a symbiotic relationship between hospitals and post-acute facilities. They're seeding each other with the same dangerous superbugs, CRE, VRE, MRSA, C. diff. So the more we achieve in the post-acute environment, the better off acute care hospital patients will be, and vice versa. We are in this together, and this collaboration makes all of us winners. Hospital patients, post-acute patients, and their loved ones as well. So I'm very excited to be announcing this. And let me just say this as well. And I see this everywhere I go in acute care hospitals. It's time for the patient to be discharged, especially an elderly patient, or someone who's, for example, just had a joint replacement. And the family is just handed a list of post-acute facilities or told, this one has an empty bed. No discussion of quality differences. None at all. It's like a lottery, a bad news lottery, right? So our goal with this RID Certificate of Compliance, this RID Certificate of Excellence, it will be an important sign to families. Well, let's put Grandpa here, or I want to put my wife here, because here, our loved one will get clean, safe care. And I know that's the goal of CareOne facilities as well. So let's applaud this collaboration before we even get started. Thank you, Tim, for this opportunity. Let me give you an idea of what we're going to discuss, a few of the issues that will be in the curriculum. We're going to start with the importance of effective environmental cleaning and move on to scrubs, mattresses, all of the things that are part of the care environment. Then we'll talk a bit about C. diff, pressure ulcers, the importance of preventing pressure ulcers, the urgent need for better attention to oral care, something that's so often neglected in acute care hospitals. Now, that doesn't mean that's all that will be in the curriculum, but Lizzie and Tim said you only can have an hour, right? So the curriculum will also include attention to UTIs, norovirus, many other things. But I just pulled out a few items that I thought you would be particularly interested in today. Let's start with environmental. And I know that this really isn't your job, right? But often when I'm giving a grand rounds at a hospital, acute care hospital, I'll ask, I'd like the most important people in the room to stand up. And of course the president of the hospital gets all ready and I say, no, I want the environmental services people to stand up. Because from the point of view of infection prevention, they're where it's happening. Absolutely. So let me start with that. There's been so much attention to hand hygiene And you can't overemphasize it, it's so important. But just remember, no matter how much hand hygiene compliance you achieve, it goes for naught if the environment is heavily contaminated. Because right after you clean your hands and pull on those gloves, then you reach up and pull open a privacy curtain, or put your hands on a bed rail, or open a drawer, and your hands are immediately recontaminated. So there has to be real attention to the efficacy of your environmental cleaning. And the studies show that so far, it's not so good. Not necessarily at CareOne. In fact, I was very impressed when I took the tour. You've achieved much more than most facilities. But for example, let me cite a study by Mike Perry at Stanford Hospital in Connecticut and Philip Carland at Boston University. They studied 1,100 acute care patient rooms, all the way from Washington, D.C. to Boston. And what did they find? That over 50% of the objects that are supposed to be cleaned during a terminal cleaning, when one patient is discharged and the next patient is admitted to the room, were overlooked. 50% overlooked. In fact, if you had to eat your lunch in one of those rooms, you should put your sandwich on the toilet seat, not on the over-the-bed table, because they never overlook the toilet seat, but often that table is not cleaned. So, what to do about this issue of inadequate environmental cleaning? Well, most importantly and immediately, focusing on working with the environmental services staff as very important partners in infection prevention. That means helping them identify the most frequently overlooked objects, and also the importance of drenching and weighting instead of the quick spray and wipe. I'll cite an example of that. Physicians at Rush Medical College in Chicago found that by doing just that, working with the environmental services staff to identify the overlooked objects and the importance of a longer wait time, they were able to reduce the spread of vancomycin-resistant enterococcus by 2/3, just with that one initiative. Imagine. So whether you're in an acute care facility or a post-acute facility, identifying the environmental services staff as your essential partners, communicating with them about the importance of what they're doing is critically, critically important. In fact, we've created a card. John, do you have one of those cards in our RID kit? I can hold it up for everyone. A laminated card which we'll be bringing to all the CareOne facilities on how to clean a room, what to look for. And we do it in many languages. Yeah. So, while we're talking about environmental services, let me add two things. Mattresses. The CDC just issued an important directive to healthcare facilities all over the United States to be more aware of the mattress as a vector of disease. Mattress covers are easily torn, bodily fluids become embedded inside the mattress. It's really important to frequently inspect mattresses to make sure the mattress is not becoming a vector of disease for your patients. Otherwise, to coin a phrase, they can become a hotbed of germs. I'm going to touch upon another issue that is a little controversial, but we'll jump in anyway. Scrubs. Believe it or not, there was a time when hospitals and other healthcare facilities laundered and provided scrubs for all their staff. That was a better day. It was a better day because healthcare laundries use hotter water and are far more effective at killing germs than your home laundry. It was a better day because it meant that you weren't bringing those germs home to your family to put in the laundry with your own other clothes. And it was a far better day from a public relations point of view because the community can't stand seeing healthcare workers in the deli lining up to pick up their children after school, on the bus, in these scrubs. So I know it's not practice right now for facilities to provide freshly laundered scrubs when their caregivers come to work, but I'm going to encourage it. It was better when it was the other way. Now, let's talk about the worst of the worst, C. diff. Believe it or not, C. diff, Clostridium difficile, has become a household name in the United States. It is by far the most frequent healthcare infection, and it shortens life tremendously. It prevents patients from recovering from the comorbidities they came in with. And so I'd like to talk a little bit about the myths around C. diff and what we can actually do to eradicate C. diff in our own facilities. First of all, you will hear healthcare apologists say, oh, C. diff, it's caused by antibiotics. Patients who are on antibiotics, they're going to get C. diff. That's really not true. That is not true. It is true that antibiotics makes patients more vulnerable to the effects of C. diff. But no patient gets C. diff unless that patient has ingested that C. diff spore. So what causes C. diff? Inadequate hygiene. And how can we combat it? Through rigorous hygiene, rigorous attention to cleaning, and helping patients clean their own hands before they eat. Here's how a patient gets C. diff. It's almost never the caregiver, except if you put a spoon on a table and then use it to feed a patient or administer medication. But generally, here's how a patient gets C. diff. A patient's in the room, there's C. diff spores invisibly on the table, on the bed rail, on the bed linens, all over. The patient touches those surfaces, and then the meal tray arrives. Or a family member brings a brownie or an apple or a piece of cake. And the patient picks up that, or a sandwich, picks up that food without rigorously cleaning their hands first, and ingests the spores that are contaminating their hands along with the food. Right? They're giving themselves C. diff and they don't know it. So what can we do to protect patients from C. diff? Well, Robert Ornstein at the Mayo Clinic has proven that wiping the surfaces around a patient's bed once a day with a Clorox bleach wipe reduces the incidence of C. diff by 88%. Why isn't everybody doing that? Imagine getting rid of such a scourge with such a simple step. 88% reduction in C. diff, because that bleach in those Clorox bleach wipes kills C. diff spores. They're not easy to kill, but that bleach kills it. The second thing we can do is much more careful attention to hand hygiene for patients. Everybody talks about hand hygiene for caregivers, right? But we need to make sure that our patients or residents' hands are clean before they eat. Now, RID has this card printed. We'll do it in any language you want. This card has English on one side and Spanish on the other. And it says, please clean your hands before eating and avoid placing your food or utensils anywhere except on your plate. So whether we are wheeling our residents into a central dining room or delivering them a meal tray or handing out snacks, we need to make sure that their hands have been wiped clean. Those alcohol sanitizers don't do the job. Really, it's the action of wiping that takes the C. diff spores off their hands. But we can really combat C. diff by making sure that our patients and residents do not give themselves C. diff in the act of eating. Now, let's see. Bed sores, pressure ulcers. Nothing is a better measure of the quality of care than whether patients are getting pressure ulcers. It's all about attention to care. Wouldn't you agree? And when we at RID urge families to choose carefully a post-acute facility, here's our brochure. You have one page of it on your table, but this is what it really looks like. And the very first thing we urge is that they look into what precautions are taken in the facility to avoid pressure ulcers. Because the stories of suffering, we get stories, emails, and letters all the time about patients who have overcome their illness in the hospital. They're going to rehab. They come down with a bed sore. It becomes infected. They land back in the hospital. Then they're on a ventilator, and they die. What a terrible, terrible reversal of fate. So, there are many factors that predispose patients to bed sores. Of course, part of it is just the natural thinning of your skin with age. I can see that on my own arms. I turned 70 the other day. I'm still dealing with that. It's the lack of mobility, the pressure on a particular body tissue, focal pressure, steroids, malnutrition, incontinence and moisture, edema, reduced blood flow to a part of the body. And of course, more than anything, there's a correlation between pressure ulcers and length of stay. But we can turn all of this around. We really know what to do to prevent pressure ulcers. It requires for each patient a plan on how to position the patient, how often to turn the patient, eliminating focal pressure, inspecting the skin regularly for any tears or breaks in the skin, and of course keeping the skin dry. And when a pressure ulcer does occur, acting quickly to prevent infection, promote healing, and prevent more pressure ulcers, measuring, quantifying the seriousness of that pressure ulcer. And of course, we have a lot of equipment to get this job done. We've got heel protectors, we've got foam wedges, we've got special mattresses, we've got kinetic beds, all of which will help us vary the pressure and protect the patient. Are you with me?
Yes.
Good. Okay. Here's another topic I've been dying to talk about, just raise. It will be in the curriculum in detail, because I hear so little about it. Oral care. So often I'm in an acute care hospital with someone who's elderly and has been in the hospital maybe for 2 or 3 weeks with endocarditis or congestive heart failure, one of the ailments that keeps people in the hospital a long time. And I'll look in his mouth, and there'll be literally a hard shell of brown bacteria covering the inside of the mouth. It's so cruel that this occurs. But patients who are weakened and in the hospital, they don't have the oomph to say, I've got to brush my teeth. And nobody takes the time. Time is so in such short supply. It takes a long time to sit there with a pre-moistened wand and chip away at that hard shell in a patient's mouth. But what happens when that forms and then starts to flake off? Very dangerous, non-ventilator associated pneumonia. Those little bits of bacteria are aspirated and cause pneumonia, among other things. So we really need to focus on oral care. It's another one of those issues that sets an excellent facility way apart from all the rest. Of course, we also know that inadequate attention to oral care contributes to dementia, cardiovascular problems, but more than anything, aspiration pneumonia. Okay, so what can be done about it? Well, we're going to be talking a lot during our curriculum on how to keep patients' heads elevated if they're bedbound, how to increase their lung strength. We've got lots of toys that do that. But most important, how to keep their mouth clean. That is the key. And the weaker the patient, the more we really have to intervene, coming right to the bedside and saying, we'd like to help you clean your mouth. Let's make sure we have the right supplies on hand. That very soft toothbrush, very soft bristles, alcohol-free mouthwash, those special swabs that are pre-moisturized and well, they usually have something like a mint hydrogen peroxide mouthwash in them. You know, many companies make them. Sage, Medline, a lot of companies make them. And if patients are apprehensive, as they sometimes are, especially if they have dementia, how to approach these patients directly with eye contact, slowly, putting the wand or the brush in their hand to encourage them to work with you. All of that is so essential, and I know extremely time-consuming. But oral care is so rewarding to the patient and to the patient's health that it is time well spent. And I hope we can figure out how to get it done all of the time. So, I know I've already covered a lot. They warned me not to talk too long. But let me say in closing, I'd like to congratulate the Strauss family and Tim and Toya and all of you who are here for already achieving so much to raise the standard of care in a post-acute facilities. I'd like to applaud you for what you are doing. I'm thrilled to be here as part of this collaboration. We at RID only have one goal, to save lives. And I know that's why you're here too. You are committed to the lives of all the residents in your facilities, and that is a beautiful thing. Thank you.